Hi, welcome everybody. We're going to go ahead and get started. Welcome to PHL Pre-K Contracts Training for FY 2025. This session is specifically for new providers, so welcome to the PHL Pre-K system. We're so excited to have you. I'm Carrie Lee. I'm the Contracts Manager. Helping me lead you through this presentation is going to be our contract coordinators, Brittany Maines and Theo Margulies. So just a few housekeeping items. Please have your phones and microphones muted. You can type any questions in the chat box. We'll get to as many questions as we can along the way. This presentation is being recorded and we'll send out the recording and the slides with the provider update that goes out every Friday. Our agenda today, I'll talk briefly about the Office of Children and Families, tell you about PHMC as the administrative intermediary. You'll hear from the Spark Quality Support Center, but we'll really spend the bulk of our time on the contract deliverables and going through each one, and just finish out the session with some reminders at the end. So I will tell you briefly about the Office of Children and Families, who is the administrator of this program, who is the lead, oversees this program at the city. The mission of the PHL Pre-K program is to increase access to quality early learning by offering free pre-kindergarten programs to children regardless of their family income. A few commitments of the program are increasing center quality and providing instructional resources, offering health resources and conducting developmental screenings, supporting staff growth and development, and promoting kindergarten registration and transition activities. So there are a few partners within the PHL Pre-K system. Of course, the Office of Children and Families, who oversees the program, PHMC as the administrative intermediary, Spark provides quality supports, and then also our program partner, the School District of Philadelphia as well. So now a little bit more about PHMC's role as the administrative intermediary. We contract directly with providers for PHL Pre-K. We're responsible for enrollment oversight, meaning that we approve enrollments, verify your enrollments, as well as monitor enrollment targets. We disperse the flow of funds to PHL Pre-K providers, and we'll talk through more what monthly invoicing looks like later in this training. PHMC is responsible for data collection, management, and analysis. We monitor fiscal and compliance, meaning that we'll support you with fiscal reports that you need to submit throughout the year, as well as support you in meeting contract deliverables. We have strategic partnerships, and that responsibility means that we're very intentional about collaborating with partners within the PHL Pre-K system, such as the Office of Children and Families and the Spark Quality Support Center, as well as organizations outside of PHL Pre-K to ensure that we're providing the best supports we can. And finally, program reporting. So PHMC is responsible for the collection of program and child level data and reporting out on outcomes of the PHL Pre-K system. Our provider service team works really closely with PHL Pre-K providers to provide high quality services and support. They do monthly check-ins and quarterly in-person site visits. So you will consistently be in communication with your provider service specialist, and they will be your primary contact for being successful in our system. We also provide accurate and timely enrollment-based payments, provide clear definition of PHL Pre-K contract expectations and monitoring, and finally identifying supports needed and making referrals to the Spark Quality Support Center, who you'll hear from in just a little bit. So if you do have any questions about the PHL Pre-K, please reach out to your provider service specialist at any time and they can help. There are variety of ways to get in touch with us depending on the topic. So you can always email the PHL Pre-K inbox or call us as well. As I just mentioned, your specialist is a primary contact as well with any questions. If you have a child work question, you can submit a ticket through this email here. And we also have contact information for families who wish to enroll in PHL Pre-K. So again, all of these slides will be sent out in the weekly provider update. So you'll have all this information available too. Now I will pass it along to Dina from the Quality Sports Center.
Good morning, everyone. My name is Dina Shurit. I am Deputy Director of Coaching and Quality Supports. And along with me today is Rex Yin. Rex, would you like to introduce yourself?
Sure. All right, good. Good morning, everyone. I'm Rex Yin. I'm the Deputy Director of Content and Learning Strategy for the Spark Quality Support Center. And I was also a former PHL Pre-K provider. So welcome all of you as new providers. I'm sure this is such an exciting new journey for all of you. The Spark Quality Support Center, we're responsible for delivering high quality support services directly to PHL Pre-K providers participating in this initiative. And the supports we have will, we hope to help you as you implement and complete the contract deliverables that will be shared today. And so to explain more about the variety and array of quality support services available, really our biggest commitment is to ensure that that we can help improve and sustain the quality of your PHL Pre-K program. So Dean and I will share a bit of how our teams can support you. First, we have a team of specialists or content experts, each specializing in a variety of fields like early childhood education, business, family community engagement, health and wellness, and equity and inclusion. And they also serve as our professional development facilitators. So if you've attended any of our trainings recently, you might have met our specialists. And they also work alongside with our coaches to provide forms of specialized consulting as it complements the coaching that they provide. I'll pass over to Dina to explain our coaching team.
Okay, coaches are a part of the Spark team. We are here to support providers. We offer group coaching, one-on-one coaching, classroom observations, modeling. We will support and guide you to the resources that you need to meet your goals. We also have our Knowledge Center. The Knowledge Center serves as an online library containing key information, self-assessments, on-demand training, and resources like tools, job aids, and templates. It's available online and accessible to providers 24/7. We will tour it more a little bit later.
Yep. And where you can find many of our professional development opportunities, our Knowledge Center also houses our events calendar. The events calendar is where you can see a calendar of professional development opportunities, whether that's a training, a professional learning circle, a community of practice. And at the moment, we are offering them on Zoom, though we will be offering in-person opportunities throughout the year as well. Really, each of the trainings do align with the various content areas that we have, so a lot of opportunities to pursue. And beyond our events calendar, we do have a training request form that I'll explain more later. And lastly, if you really don't know where to start, on our Knowledge Center and on our website, we do have a help desk lead who will, you can either call or do a live chat during regular business hours, and they're available to really provide any resources or guidance or even connect you with your PHL Pre-K coach if you're not sure who that is. Spark QSC is here to really help guide and support your journey as being a high quality PHL Pre-K provider.
Okay, a little bit more about coaching. Spark Quality Support Center coaches will help implement the contract deliverables. This is how it happens. First, you will be offered an initial site visit. During that initial site visit, there is an intake survey that will be shared with you. You can complete it during that visit, or you can complete it later and submit to us. The intake survey will help. You will indicate what supports you may be interested in receiving. We will support the implementation of contract deliverables that ensure successful implementation of your PHL Pre-K program. We will support curriculum by way of the curriculum unboxing. We will support with classroom schedules, classroom arrangement, classroom management, and we will also support around the child outcomes using the TSG system. We will help establish understanding of the why behind the requirements and how they impact classroom and business practices. And we have a plethora of resources that we are ready to share with you. Next slide.
Great. And to share further about how our specialist team can really, our content specialist teams can support all of you with these contract deliverables. When it comes to our professional development opportunities, really strive to realign them to the contract deliverables timeline to really ensure providers have access to the knowledge and skills necessary to follow through with them. So for example, topics like collecting observations and documentation we have a training on that we would offer as it aligns to upcoming teaching strategies code checkpoints. We have a training on budget that we would offer in time before mid-year expense reports are due, and other topics like building positive family partnerships as we're thinking about cultivating positive family communication, and so many more. And then other opportunities we do have on-demand trainings to be released. We do have currently we just released a business and marketing flyer that contains resources and training and on-demand trainings that you could participate in. All of our on-demand trainings, these are online learning modules available through the PA key. So once you do that, you can get credit through the PA key along with PCOS. And then similarly, all the trainings that we offer are in various formats. And right now we do have summer professional development offerings available for teachers and administrators to get ready for the new school year. In August, we will be offering PDs around curriculum implementation to support with that. And we're also in the process of releasing information for a full year professional development calendar, in which it will include full day in person or half day virtuals or 1 to 2 hour learning opportunities, along with any topics that we hope to cover through each month. I'll also add just a plus one to Dina really quick is that our coaching team will also be offering monthly office hours. So those are also opportunities that you can plug into to engage with your PH or pre-K coach on a month-to-month basis regarding a lot of those contract deliverables. And yes, our Knowledge Center is a hub of resources, so I will be dropping that link in the chat. Please explore it further. And if Spark is available to offer individualized supports, especially upon receiving referrals from PHMC, or if you're engaging with your coach and seek supports, the coaches and specialist team will engage in a collaborative manner to support you on those things. And lastly, in addition to all these various professional development opportunities, we do have the training request form for providers who request trainings from the Spark QSC. I'll share the link in the chat also, where you can see our catalog of trainings in which you can choose from. Once you submit requests, we then will start a process to do some intake and confirming some details. And this is our Knowledge Center. I'll drop the link in the chat here for folks to explore. We've been striving to really make sure it's as user-friendly for all of you, but here on the screen, at the very top of our Knowledge Center website is just some header links that can direct you to resources, whether that's to our events calendar, our coaching, the Knowledge Center, or our help desk. And then at the bottom there, treat this kind of like a PH or pre-K Google, where you can go to that search bar and type in some keywords, and then it will produce a result of some resources that we've collated for PH or pre-K providers. We have probably hundreds, if not thousands, of resources now in our Knowledge Center as we've been working on this for the last 3 years. And please let us know if there's anything that you would like to see on there. We're really trying to make sure that this contains all the resources that's relevant and important for all of you. And here is a GIF or like a moving image to kind of walk you through our events calendar, which is another innovation that we've been striving to improve on year to year for all of you as participants of our trainings. What's great now with our current events calendar is that if you go to our events calendar and you click any of the professional development opportunities that we have, you'll be redirected to that events page essentially, and then from there you begin the registration process. If we don't have your information in our systems yet, no worries, you can enter that in here manually, and guess what? It gets saved for the future. So after this one-time registration for any of our training events, for the future, it will pre-populate and forward. If we do have your information currently in our systems, it will also pre-populate there. I will suggest just double checking your information so that it reflects your emails, your PAKey ID numbers, or the provider site that's affiliated with your account. And yeah, this is our website. Dina threw that link in the chat. This is also our phone number and email to reach our help desk for any general support that you're looking for. Feel free to contact us. Again, this slide will be shared after this this training, so please take a look at. Please save our information and keep it on file for all of you.
Thank you, Rex and Dina. So now let's dive into the PHL Pre-K contract deliverables, which we'll spend the majority of our time on today. So first we wanted to draw your attention to a few resources to help you understand all the deliverables. First is a new resource. It's a deliverables checklist, and this is for Q1. So we hope to develop each checklist for the 4 quarters. It is a new resources to help providers prepare for major FY25 PHL Pre-K deliverables or other activities that need to be completed during this quarter. Provider service specialists will also be using this document during site visits or check-ins. We also have the deliverables review timeline dot chart. This is included in your PHL Pre-K contract, but we wanted to pull it out separately. Gives an overview, a snapshot of what monitoring looks like. So we're going to pull these up really quickly just to give you an idea what they look like. So this is the landing page, or we'll drop this link in the chat as well to the landing page where you can access both of these documents. So this is the deliverables checklist by quarter. So this is Q1 is available right now. So on the left-hand column, you'll see each deliverable and activity. The next column is things you should be considering doing during this quarter. It has deadlines, monitoring timelines, and then also a column for you to be able to write in notes and progress. Then we have the dot chart, which again is a snapshot of when monitoring will happen. So y'all can take a look at these documents when you have a little bit more time. And we can go back to the presentation. So here is a full list of deliverables we'll be reviewing with you today. We did review some of them already at enrollments, trainings, or exhibit info sessions. And so that's the deliverables underneath that orange header there. We're going to be just going over those briefly at the end. But some of these deliverables as new providers, they may be new to you. So we're going to be going over license and stars in good standing, religious affiliation and discrimination, adhering to health and safety guidance, full day, full year services, family partnerships, health assessment and health and nutrition standards, curriculum, outcomes assessment and developmental screenings, data management, complying with monitoring and reporting requests, meeting and training participation, City of Philadelphia compliance. We'll go over invoicing and payments and fiscal adherence, including all the fiscal reporting, and then termination as well. So again, we reviewed some of these items that I'll go through right now at enrollment or exhibits info sessions. So that's the growth timeline for growth, the growth providers, the timeline you need to adhere to move up to star 3, program dosage, enrollment and recruitment, eligibility, attendance, suspension, expulsion, kindergarten transition, remote learning, staff qualifications, and adhering to the Philadelphia 21st century minimum wage benefit. Okay, so now we'll go through all the deliverables, and Brittany will start us off.
Thank you, Carrie. Hello, everyone. Our first deliverable is the DHS license and compliance. As providers, you must maintain a Department of Human Service or Philadelphia Department of Education license, and it must be in good standing. You must serve children at that approved location. However, if you are planning on moving, you must get OCF approval before shifting your PHL pre-K children to that new location. If there are any providers who potentially receive a provisional license throughout the calendar year, you are able to still operate and provide PHL pre-K services until the end of that calendar year or this fiscal year. We do also, want to make note that you as providers must contact the contract entity of any significant findings pertaining to your classrooms or your site locations within 30 days of notification. And lastly, if any PHL pre-K staff observe any violations, you must report it to the appropriate agency immediately. Rescinding and voiding a contract. A provider's contract can be rescinded or voided for several reasons. Such reasons include the following. If you receive a provisional license before the issue of your PHL pre-K contract document, if you receive a negative sanction that results in your facility closing, if any violation results in the emergency removal of children, or if there is fraud to be determined that was discovered during your DHS licensing. OCF and the contract entity need to be notified immediately if any of these instances occur, and then we'll be able to support families with a relocation. Providers, you need to self-report any PA-DHS violation within 48 hours to Octal, as well as PHMC or the school district if you're a school district site. Such violations will include the following. If an injury at your center that requires emergency room treatment or inpatient or hospitalization, if the death of a child receiving care at your facility occurs, a facility fire that requires the services of the fire department, any verified incident of child abuse or neglect, any violation or regulation causing a child endangerment, injury, or death, and any STAR suspension as well must be notified. We must be notified. Religious affiliation and discrimination. Providers with religious affiliation may still offer programming in accordance to your belief, but however, you cannot deny a child's enrollment based on their religious affiliation. You must let families choose to opt out any religious programming, and you cannot provide religious instruction during the 5.5-hour PHL pre-K school day. Providers, you should not discriminate or permit discrimination against any child, staff member, or potential employment candidate because of race, ethnicity, color, sex, sexual orientation, gender identity, religion, national origin, ancestry, disability, marital status, familial status, or domestic or sexual violence victim status. Adherence to health and safety guidelines in child care settings. Providers, you are expected to review and adhere to health and safety guidance from the Centers for Disease Control, the Office of Child Development and Early Learning, and the City of Philadelphia's Department of Public Health concerning any future emergencies. Additionally, you must continue to still report positive COVID-19 cases to the Department of Health as well. Full day and full year services. Providers, we want to encourage you to partner with other agencies for full day and full year services. Families who express a need for full day, full year services and who are interested in childcare works should reach out to the CCW in order to determine their eligibility. Families can apply through the Compass portal or contact their local Early Learning Resource Center. We do want to emphasize, as providers, you should only fill out the PHL pre-K enrollment verification form after your families have been determined eligible by the CCW and also selected your site as their location. This form should not be completed for each enrolled child. This form also needs to be updated if there are any changes, especially if that child leaves your program. Our next deliverable is the family partnerships. Providers should communicate regularly with families or caregivers using various methods. Such methods include creating a system for reporting about a child's progress and getting feedback, as well as using languages and platforms families can access. Additionally, we need to provide ways for them to help in planning events, trainings, and/or workshops. As we did mention in the exhibits info section, you as providers should have a family grievance policy that outlines concerns and processes for these as well. Providers, you should also work with OCF to deploy any resources to PHL pre-K families and support the distribution and completion of year-end family satisfaction surveys. Health assessment. Providers, we want you will need to verify that at least a child health assessment is on file and it's also kept in that child's file at your location. You will need to participate in initiatives identified by OCF to ensure that children are enrolled in PHL pre-K have access to health screenings. And lastly, children should not be denied access to PHL pre-K or discharged if these screenings are not up to date. Appropriate health and nutrition standards. As providers, you will need to provide nutritious meals and snacks every day, as well as adhere to age-appropriate nutritional requirements from a recognized authority. Providers are strongly encouraged to participate in the Child and Adult Care Food Program for these nutritional requirements. Providers, it is strongly suggested that you become familiar with the Philadelphia Nutrition Standards for ECE. These links are attached here on the slide for your later convenience. There are standards around physical activity, screen time, as well as the importance of offering clean, safe drinking water. And these also do remain the same from last year. But some of these standards, just to reiterate, they include offering at least 60 to 90 minutes of physical activity, ensuring that you are limiting the screen time to 30 minutes or less per week for children ages 2 and older. And as I stated before in the previous slide, the importance of clean drinking water. Childcare facilities with 13 or more children must test all portable water outlets for lead and submit results to the Department of Public Health. There is a link on this slide for you to read more about the city's ordinance requirement. And additionally, we just want to strongly encourage that you set goals and develop strategies to ensure that fried foods are not offered more than 2 times per week at your facility. All right, and the last deliverable I will be detailing will be the curriculum. As providers, you must implement program-based that is required by PHL pre-K required curriculum known as creative curriculum. Your curriculum kits are being mailed directly to your new sites, and you should be receiving them mid-August. So please reach out if you have not received them by then. Teaching staff and program leadership support are available through the Spark Quality Support Center or the School District of Philadelphia if you are SDP site. Providers, you are permitted to use a supplemental curriculum, providing the supplemental curriculum is on the Octal approved list. However, we just want to ensure that creative curriculum is still going to be remaining primary. So we'll take a break for questions before we move on.
I don't see any in the chat yet, but please feel free to go ahead and put your questions in and we can get to them in the next section.
All right. So next I will be going over outcomes assessment, which is teaching strategies gold. So for TSG, observation records for each PHL pre-K child must reflect all months of service when children are in care and each domain of development as outlined in TSG. Each child should have a minimum of 1 documented observation in every dimension per checkpoint timeframe and a minimum of 2 family conferences to discuss progress and set educational goals. The record of child progress using TSG online data tool should be reviewed twice per year in February and again in May. For returning providers, TSG licensing will roll over from the last year and is effective in July. And for new providers, you should have received a welcome email about TSG last week to be able to access your account. Your account will be covered by PHMC for only your PHL pre-K children. It's important that your contact form is up to date because we ask who your TSG administrator is, and we need to make sure that we are giving the right person access. So next is developmental screening, which is the ASQ3 and the ASQ SE2. So we started moving to ASQ online last year, and all will be required to use ASQ online this year to record developmental screening information. And this applies to only PHL pre-K seats. ASQ3 and ASQ SE kits have been ordered for new providers and those who don't have a key code. Specialists will be delivering these and you should be receiving them soon. All providers should have an ASQ online key code entered into ASQ online. Everyone except school district providers should have been invited to a training at this point as well. If you have not, you can reach out to Cassandra. If you haven't taken a training, please take one as soon as possible. And we have a list of those who haven't attended one, and we will be sending emails to those providers about upcoming trainings. You will need to complete at least 1 developmental screening reflecting all domains of development for each child annually within 45 calendar days of the child's program start date. You need to share information with families within 14 days of completion and refer any child with an identified concern to Elwyn for assessment. Providers will also need to document their referral to Elwyn and the receipt of parent permission to refer within 7 calendar days of the conversation with the family. You will need to rescreen per tool guidelines if there are concerns identified. Children with IEPs are exempt from this requirement if their current IEP is in the child's file and in childware. For children with an IEP, programs may be asked to complete an ASQ SE if there is a request for ACMH services. So next, I will be going over data management, record keeping, and communication. So providers will use multiple databases as a PHL pre-K provider to enter staff, child, and site level data. To ensure timely and accurate data is collected, providers need to develop systems for data entry, quality assurance, and resource allocation, such as time, staff, and technology. The systems you will use are Free Philly Pre-K, Childware for enrollment and attendance, the PD Registry for staff qualifications, Teaching Strategies Gold for outcome assessments, and the ASQ Online for developmental screening. You should think about how you're going to manage keeping these systems up to date as we do monitor them to make sure that they are up to date. So next is contracts monitoring, program assessment, and reporting requests and engagement. So PHL pre-K providers are expected to comply with all monitoring and reporting requests made, participate in quality improvement activities when they're recommended, participate in the data collection and evaluation activities, including external evaluator NEAR and quality support such as TA and coaching as recommended or directed by OCF or its designees. Participate in at least 1 in-person coaching visit with the Spark Quality Support Center. And there will be opportunities to participate in continuous improvement of the system. We hold trainings and meetings like contract entity meetings related to PHL pre-K deliverables. So next is the City of Philadelphia compliance. So providers are expected to maintain good standing as a vendor with the City of Philadelphia. They're Providers are expected to fulfill all tax obligations, city, state, and federal, and we do monitor city tax compliance on a monthly basis. And also adhere to the City of Philadelphia general provisions, and that's an attachment to the contract. So next I'll go over invoicing. So providers may begin expending anticipated funds in July of 2024. However, initial payments are dispersed after the first month of service. Providers receive $1,000 per approved enrollment if the child attended at least one day in the month. Invoice can never exceed the total slot allotment, and provider payments are performed monthly using the enrollment count in childware. Invoices are submitted across 10 months, so October to July, by the 10th of the month following the month of service. It's recommended that you submit before the 10th, so if there's any discrepancies, those can be resolved before the 10th to ensure timely payment. Failure to submit invoices by the 10th could result in a quality improvement plan. The administrative intermediary is notified if there's any discrepancies, and these must be corrected prior to invoice submission. School district providers will be paid based on terms outlined by the school district provider agreement. Payment to providers will be made within 21 days following approval of invoice. Eligibility verification will occur within 60 days of enrollment, and recoup for payments will be made for ineligible enrollments. In FY25, for September and October invoicing, payments will be based on slot allocation, and the first invoicing period will be October 1st through 10th. So the next few slides will be about fiscal expectations. So there are several levels of fiscal review that occur for fiscal reporting, and for returning providers, these are the same as last year. We'll hold a fiscal training session in the fall for providers to go over these expectations in more detail, the financial systems that you should have in place, and also the Spark supports that are available. For any fiscal reporting, providers should be submitting on time. If you don't have systems in place, you should be reaching out to the Spark Quality Support Center to help you make improvements. So the first level of review is the desk review. PHMC will perform a desk review for a 10% randomly selected sample of providers with annual PHL pre-K revenue below $300,000, or providers that have been identified as having fiscal concerns. The desk review will verify adherence to PHL pre-K billing and fiscal reporting guidelines, and PHMC may recommend corrective actions based on the findings of the desk review report. The next is the mid-year expense report. All providers will be required to submit mid-year expense reports. And then there's also the end of year expense report reviews. So PHMC will request year-end expense reports for all providers with FY25 PHL pre-K revenue below $300,000 that are not selected for the 10% desk review sample. PHMC may implement additional fiscal monitoring based on the findings of the expense report review. For returning providers, you should have already received an email about FY24 fiscal reporting requirements with the due dates. So next are the fiscal expectations. So for those that need external fiscal reviews, the thresholds are the same as last year. For providers with $300,000 to below $500,000 in PHL pre-K revenue, you will need to have an external certified public accountant to conduct an agreed upon procedure or an AUP. For providers with $500,000 or more in PHL pre-K revenue, you will need to have an external audit in accordance with the generally accepted government auditing standards, which is also referred to as a yellow book audit. And those with $750,000 in federal funding will require a federal single audit. So fiscal expectations. So if you fall into a category that needs to submit an external review, it's very important that you submit a separate PHL pre-K schedule. The reporting period should show how each program year that is part of the provider's fiscal year. So if a provider's fiscal year ends December 31st, that covers 2 program years. So it should break out that that January to July, or sorry, January to June, and then also the September to December time. It should also include a separate PHL pre-K schedule to show PHL pre-K funding and expenditures. So next is fiscal timeframes. So providers who need to complete external reviews must complete it 3 months from the close of the books for their fiscal year and submit annually by October 30th of the following program year. Providers may submit a request for a one-time extension to PHMC. It is a 90-day one-time extension, and it may be granted if the request includes an engagement letter from an auditor. For consideration of an extension, a compelling reason must also be provided. So these are the compliance definitions. These definitions are here for your reference and illustrate the levels of written notification. If there is a compliance concern, notifications can range from a quality improvement plan to a notice of termination. So if any of the items on this slide happen, it may result in the termination of a contract. As we mentioned, failure to maintain DHS or PDE license, failure to get and maintain appropriate insurance coverage, if a provider has unresolved noncompliance with a notice of default, or if a provider has egregious areas of noncompliance relating to jeopardizing the health and safety of children, preventing or restricting access to PHL pre-K services, creating undue hardship for families of enrolled PHL pre-K children, or compromising PHL pre-K program integrity and public message, or impacting the accuracy of payment for PHL pre-K service. If terminated, a provider may be ineligible to reapply until at least 1 year from the termination date, and they would also need to apply with an active application cycle. So if a PHL pre-K provider receives a notice of default, they may submit a written appeal. Written appeals must be made within 10 business days of the non-compliance notification. They should include supporting documentation, demonstrating the compliance. OCF, PHMC, and contract entity, where appropriate, will respond to the written appeal within 20 business days. The final written decision from OCF will be binding. If the appeal is submitted without written documentation showing the program's compliance, the notice of default and timeline will stand, and Spark will provide responsive interventions to remedy deficiencies. So now we will be going over some of the deliverables that were reviewed at the enrollment and exhibits training.
Thanks, Theo. So I didn't see any questions along the way, but please feel free to drop them in the chat. I know it is a lot of information and a lot to digest, but if you do have any questions, we'll have some time at the end to get to them. Okay, so I am reviewing information that you should have already received through either the enrollment trainings or the exhibits info sessions. This one right here around enrollment and recruitment was information shared at the enrollment training. If you do have any questions about enrollment, please send it to the PHL pre-K inbox, or also attend the upcoming question and answer sessions. Those are always detailed in the provider update about when those sessions are available. So just as a reminder, Free Philly Pre-K launched. So you should be encouraging your families to apply online. Around enrollment and recruitment, providers also need to develop and maintain an enrollment and recruitment plan, maintain 100% enrollment with a wait list of eligible applicants in childcare. You must enroll and discharge children per the requirements outlined in the FY25 PHL Pre-K enrollment provider policy. You should be working with families to determine if the program is a good fit for the family's individual needs and priorities. And you may not require any additional applicant information or fees in advance of enrollment in the PHL Pre-K program or in association with the PHL Pre-K services. So this includes requesting fees for supply lists, lunches, trips, or uniforms. So that would not be allowed. Around enrollment analysis, providers must meet enrollment targets. The 50% benchmark is by August 30th, 2024. The 100% benchmark is by September 30th, 2024. Sites that have seats that are vacant for 30 days or more will be contacted and asked to develop a recruitment plan. Referrals may be made at that time to the Spark Quality Sports Center for assistance. And additionally, OCF will determine if and when reallocation of PHL pre-K seats may be necessary. If slots are reallocated, and we do have any seats available, slot increases will be prioritized to sites that meet the following criteria. So there are star 3 or 4 level, demonstrate PHL pre-K contract compliance. This is mainly for returning providers who are returning this year. We'll look at your data from last year. If you're meeting 100% enrollment and have an active wait list in childcare, meet priorities determined by the City of Philadelphia, the Office of Children and Families. And then you also attest that the new slot is in a classroom that meets all PHL pre-K requirements, including required staff-child ratios and qualified staff. This information about eligibility was shared at the enrollment trainings. This is exactly the same as what was shared there. So children must be 3 or 4 years old by September 1st, 2024 and live in Philadelphia. PHL pre-K seats may be offered to newly enrolling children and children aging into the program. You are not able to reduce or discontinue infant, toddler, Head Start, or pre-K count services to expand PHL pre-K services. PHL pre-K funds may be used to convert a child subsidy or private pay child when they become age eligible. Children who receive pre-K services under subsidy or private pay may be offered a PHL pre-K seat when they become age eligible. And PHL pre-K seats may be offered to a family losing eligibility status for federal or state funding. Current star 3 and 4 providers need to maintain good standing in stars. All growth providers entering the system below a star 3 or 4 or below a star 3 must comply with certain deadlines to be able to become a star 3 or higher. Growth providers should have turned in their star 3 action plan and waiver yesterday. If you have not done so, please submit it immediately to the PHL pre-K inbox. At the exhibits info session, we detailed that providers should schedule a minimum of 108 days of PHL pre-K services between August 26, 2024 and June 30th, 2025. There should be 5.5 hours per day of developmentally appropriate instructional time in each PHL pre-K day, and that should include at least 60 minutes of physical activity. We also went over this at the exhibits info session. Just a reminder that providers should have submitted these policies by the deadline yesterday in the online platform. So providers need to have an attendance policy, enrollment and waitlist policy, family grievance policy, suspension and expulsion policy, and also kindergarten transition plan. You can use the PHL pre-K template or upload one of your own. If you have any questions on any of this, you can reference the PHL pre-K policy guidance workbook, which we've linked here, or also please reach out to your specialist or the PHL pre-K inbox. Just a reminder about attendance policies, that your policy should include developing strategies to help maintain 85% average daily attendance. The goal of maintaining 85% for all children is because we know this supports their learning and development. If you're seeing children below this level, providers need to be reaching out to families to understand why and provide supports and resources to overcome barriers. Additionally, providers should develop clear procedures to deliver and document supports that remediate chronic and consecutive absences. Slots will be held for 30 days for children who have an approved extended absence due to long-term illness. And providers need to understand they cannot discharge a child without making every effort to communicate with families and assist in overcoming barriers. You should ensure that procedures are in place for parents to sign in and out children. And providers also need to enter weekly attendance into childcare, as well as keep supporting documentation for compliance purposes. If a child has chronic absences approaching 30 days, you should be doing the following. You should notify your contract entity. Providers will be asked to submit documentation of regular communication with families during their period of absences. It's recommended that you use a variety of communication strategies. That if families are not responsive, providers will also be asked to submit documentation from the family about planned absences as well, if that's applicable. So after that's done, the contract entity will talk this over with OCF, review this by case, and a determination will be made by OCF about whether the child should remain as an active enrollment or if this child should be discharged and added to the wait list. In these cases, PHL pre-K invoicing policy will still apply. So once a child is discharged, providers have 60 days to fill that seat. And failure to comply with these steps may result in PHMC not continuing to fund that PHL pre-K slot and a provider not receiving payment. Okay. So now we will move on to recruiting and retaining qualified staff. We went over this information as well at the exhibits info session. So PHL pre-K credentials are aligned with the state's career pathway. You'll see the chart on the left-hand side are PHL pre-K credential requirements. So a director administrator, family childcare owner operator, and a lead teacher all need to have a pathway level, the minimum pathway level of a B. And then assistant teacher needs to have a minimum of an A. So what that means is you can see the chart on the right-hand side, that's the career pathway levels. So staff must meet one of the qualifications in a level in order to meet that, that level of the pathway. So for a level A, you need to either hold a current CDA certificate from the Council for Professional Recognition, current school age credential, or have 9 ECE credits. For a level B, you have originally accredited ECE focused ASB or AST, an associate's in ECE, an associate's or bachelor's in a related field with 18 ECE credits, an associate or bachelor's degree in an unrelated field and have 30 ECE credits, or have an elementary education degree with 12 ECE credits. Okay, so all staff need to be entered in the PD registry and maintain a verified career pathway level. New hires need to complete their profile and have a verified pathway within 45 days of hire. For substitutes, substitutes must have the appropriate credentials for the position they're filling. When a substitute serves as a lead teacher or an assistant teacher for 90 days or more, providers should develop a quality improvement plan addressing the program staffing plan and strategies for recruiting qualified staff. For family providers, this would be instances where the owner operator does not serve as the full-time lead teacher and has a substitute in a lead teacher role. So if staff do not meet qualifications criteria, they may be eligible for a waiver. So please review eligibility criteria. We'll drop these links in the chat now. So we'll drop the eligibility criteria. Waivers should also be submitted for existing staff right now. Please do that as soon as possible. If you have new hires, obviously do that as soon as possible once you have them on board. We also developed a new resource, staff waiver decision tree that we'll pull up now just to give you an idea. This has helped really to help you determine if your staff are eligible. So as you can see by this little tree here, you can, if you're able to answer yes to a certain set of questions, then staff would be eligible to either submit for a waiver or get a temporary exemption. So we will drop, yep, so that those links are being dropped in the chat right now. Okay. Just a few more slides to get through. So again, we talked about this. Providers must comply with the 21st century minimum wage benefit for PHL pre-K staff. This will increase to $16.35 this year. And for more information on this, you should review the code that will be linked in this slide here. Exemptions include agencies with 5 or fewer employees, nonprofits with a contract award of less than $100,000. And if you're unable to meet the requirement, you should request a temporary waiver, which is submitted directly to the city for approval. If you need that form, please contact PHM. Please contact the PHL pre-K inbox and we can provide it for you. We also mentioned at the exhibits info session that your providers are expected to be offering services in person. Providers should have a remote learning plan in preparation for any emergency closures though. So the deadline to submit that form was yesterday, July 30th. If you haven't submitted, please do as soon as possible. We can stop to see if there are any questions. We know, again, this is a lot of information. You may not have questions now, but if you do have questions later, please reach out to the PHL pre-K inbox. You can also reach out to your specialist as well. Also wanted to remind you, we have the resources available too. There is a question about, someone's asking about offering, PHL pre-K providers offering, or being able to charge late fees. So you're not able to charge, families late fees for those PHL pre-K hours. All right, so when we move on to the last slide, this is just a reminder, all of these things were due yesterday. If you have not turned them in, please then turn them in as soon as possible as they apply to you. So all the exhibits, required policies or other documents were due yesterday. You needed to submit online. All providers need to complete the remote learning plan form in the online, on a different online form. If you need to apply for a waiver for curriculum assessment or developmental screenings, please do that as soon as possible. Staff qualifications as well. If you have existing staff, please, that need waivers or that are eligible for waivers, please apply for them as soon as possible too. And also the contact form as well. The contact form, you're able to specify different contacts for a variety of contract deliverables. So please let us know who that person is that we should be contacting for different things like enrollment, for contracts, training and things like that. So please complete your contact form as soon as possible if you have not already. All right, well, that's all we have for you today. Thank you so much for joining. We're really excited to have you all in the PHL pre-K system, and look forward to engaging with you all soon. Thank you.